The body keeps the score. If you haven't read the book, you should. Bessel van der Kolk. More and more I'm seeing this in my practice, and I'm seeing this correlation and this idea that we have to get back into our bodies in order to heal the mind. And we have to get into our minds in order to heal the body. It's a two-way street. Polyvagal theory brings this into relief. And we don't necessarily understand all the components as to how this is the case, what's going on. And I think sometimes we limit ourselves in boxes when if we were to utilize more of to what extent we have an understanding of this connection, I think we get a little more traction in terms of healing certain kinds of things. Case in point, the guts and PTSD, complex PTSD, trauma, anxiety. Those are all, certainly in my experience, related. And it's often the case that I am working with someone who has PTSD, complex PTSD, and irritable bowels. So a case came to me, it's been a few years, with ulcerative colitis. So ulcerative colitis is a condition where intermittently you have flares of diarrhea, typically bloody, and then periods in between of calm. And the typical pattern is over time, these intermittent flares worsen, become more severe. You can have bowel movements that in the middle of a flare happen 10, 15, 20, 30 times a day. And then in the rest of the time, when not in a flare, something closer to normal. So this patient came to me with ulcerative colitis. And in trying to address their symptoms, we've gone naturopathically aimed at trying to treat the gut and finding a tailored medicine that's going to help this patient. We've gotten some traction there. But another important component in this case has been understanding what's going on the mental emotional level. Case in point, history that really didn't have a label was, childhood where mom likely has had a personality disorder, probably narcissistic abuse. Narcissistic personality disorder would be my guess. Given, what's described to me, even up to this day, the behaviors are gaslighting, ambient abuse, manipulation, flipping things around on the patient where the mom's abusive behaviors, she is the victim and the patient has somehow perpetuated this on. And the patient has, people pleaser type tendencies, poor boundaries in the relationship with narc mom, and really, inability to say no to manipulative mom. So what's been interesting in this case is as we've progressed and looked at those pieces and tried to understand, establish boundaries, the GI has improved. But the other piece to come at it that I think, because of our culture and the way we tend to orient ourselves towards disease, towards pathology, is there's this kind of this polarizing, this antagonistic scenario that gets set up where we're at war against the disease. And I don't know that helps us much, if at all. In fact, it may cause tremendous harm. Because what happens is, culturally, you're fighting this illness, and that takes a lot of energy and this antagonism, all really, when you think about it, towards yourself. And it's looking through a naturopathic lens, this illness is, on some levels, you have to ask the question, how is it the solution? And so what's quite illuminating and interesting is to look at it through that lens and to say, how is this the solution? Okay, what's going on in the GI? Oh, we've got involuntary stools. The boundary with the outside world in the GI is gone some of the time. It sounds a bit like a picture in terms of what the mental emotional landscape was for this patient. Right? There's no boundary with mom. The body is demonstrating that to a patient who, at the time, certainly upon coming to me, is not aware that that's what's happening. Yes, I'm going to help acknowledge that and validate that and give it a label. And I'm going to say, yes, I think there's personality disorder going on here with your mom. Right? That's part of the healing is for that to be labeled or recognized. And maybe we don't even have to go to the point of having the actual label. Is it NPD or not? I don't really care. There's an issue with boundaries. Mom, for whatever reason, is not respecting your boundaries. Now your body is painting a picture of that, the lack of boundaries. So rather than this antagonism and this forceful, let's shut down the symptoms, I find it's much more useful to ask the question, how are these symptoms the solution? How are they painting a picture as to what might be the solution? How are they a guide? How is there wisdom in these particular symptoms? And my experience of this in practice is asking these questions, there is brilliance, absolute brilliance in the wisdom of the body, right? We can't necessarily delineate, is this the healing response itself? Is this the pathology? At what point does one become the other? To be frank, we don't know enough about what's happening. We know the cells get inflamed, but whatever the case, no matter the illness, we don't fully know. And I think if we take the position that there's tremendous wisdom and insight that we can gain if we ask those kinds of questions and restore communication, it's absolutely brilliant. That's been my experience. The insight that our bodies have into what is going on for us is absolutely brilliant. Do not denigrate it or ignore it. Take it on and listen to it and dialogue with it. So one of the things I now do routinely is tell my patients to keep a journal. You're going to talk to your GI. You're going to talk with your gut and ask your gut, what's going on? What am I missing? And even when the level of emotional literacy in terms of what's happening out here with mom, right? In this case, there's not a recognition of that this is abusive. The patient gets kind of clouded and, the gaslighting confuses the body knows on some level and is expressing that. Also expressing, the organs weep what the eyes do not. And so the colon is weeping. The colon is expressing. The colon is showing there's no boundary. And so as we ask for that insight, we end up healing on both levels. And the two inform each other. They're linked. We learned, and the patient told me recently, oh, this flare, I'm starting to recognize the emotional landscape, the literacy of this flare prior to it starting on whatever X day. I was incredibly angry about this event. And then the flare came on. And there's this emotional, the tuning into the emotional literacy and developing that and trying to tap into that helps heal the GI. And now we recognize, okay, this emotion precedes the GI losing its ability to hold things together. The GI loses the boundary after I have this anger or this sadness, etc. And the more we get in tune with that, the more we see healing on both fronts. So my challenge to you all is, number one, stop looking at your body as this thing that you're at war with. You're not at war with your body. And no matter what you've got going on physically, it's not a war. Rather, become your body's teammate and start orienting yourself where, okay, what are you trying to help me understand? What am I missing? And it will blow your mind. I can almost guarantee it. It will blow your mind, the insight that is embedded in the physical symptoms in your body. So start a dialogue, keep a journal, begin writing letters to my GI tract, and see where that gets you. I think you'll be amazed. And if you care to comment, I would love to hear your stories about this bit, especially from practitioners. If you're treating holistically, in fact, would love to know what you're seeing in terms of, shoot, let's have a conversation. Thanks for tuning in. Adios.